moving into sort of my personal clinical interest, which is dementia. And before we get started with dementia, we'll go over delirium, which is a very commonly tested sort of associated condition. Delirium, for all of you in questions, is going to be a reversible confusional state. They're going to highlight that they fluctuate, right? Often you'll see things like sundowning, right? The confusion will get worse at night. The profound symptom of delirium is impaired attention, which often makes people think that there's a memory problem, right? So I will say sometimes to patients that if you told your sibling, cousin, niece, nephew, someone younger than you to do something while they were watching TV, they would be quite distracted and they wouldn't remember to do it later. It's not that they have a memory problem, it's that they have an attention problem at the time that you sort of ask them to put that information into their brain. Think of delirium as a complication of illness or medications. There's a huge list of medications that are most likely to cause delirium. Typically things that are sedating are going to be more likely to cause delirium. It's more common in people who have kind of a poor substrate. You'll see some people talk about. So underlying neurocognitive disorders, right? And I sort of think of that as the same way as I would think about an ankle, right? If you've previously fractured your ankle or torn a ligament in your ankle, and I put you through minor stress, you're more likely to have an injury to your ankle than someone who has no underlying ankle pathology. Treatment for delirium is non-pharmacologic first, always, right? So if you're ever in a next best step question, as long as the person is not posing a threat to themselves or anyone else, it is removal of the offending agent, right? Whether that be illness, sort of gentle reorientation, right? Keeping people's windows open during the day, helping them see and hear, all the things that sort of led to this confusion in the first place. If people are at risk to hurting themselves or others, haloperidol is the agent of choice.